Hi, my name is Rafael Braga, and this is a video describing a couple of exercises used to strengthen an ACL tear. These exercises are used after ACL construction and are beneficial towards stabilizing the knee. The two exercises that will be discussed are the leg press and the leg curl, which target the quadricep and hamstring muscles. Now, when you enter physical therapy for an ACL injury, you are targeting the knee and trying to strengthen the knee. That is not the case. You are targeting the muscles surrounding the knee so you can stabilize that area. The two major muscles that are considered knee stabilizers are the quadriceps, which extend the knee, and the hamstrings, which flex the knee. For those who may not know, ACL stands for anterior cruciate ligament. It's one of many ligaments in the knee. The function of the ACL is to resist anterior translation and medial rotation of the tibia. ACL tears are one of the most common knee injuries, with over 100,000 ACL tears in the U.S. occurring annually. Most ACL tears are a result of landing or planting in cutting or pivoting sports, with or without contact. Most serious athletes will require an ACL reconstruction through surgery if they have a complete tear and want to return to sports, because the ACL is crucial for stabilizing the knee when turning or planting. Now, before you begin the exercises in physical therapy, you need to reduce the swelling in your knee and gain as much range of motion in that area before you complete these exercises. On the stationary bike to warm up. They're usually on this machine for 10 to 20 minutes, and it helps with movement of the knee joint and knee flexion. This movement allows for more comfort because it allows the knee to only flex 90 degrees, which allows for less pain for the patients. This machine is what we consider a leg press. This machine targets quadricep muscles and it strengthens them by extending and flexing the knee. As you can see, you extend and flex the knee to strengthen the quadricep muscle. Avoid fully extending the knee and snapping. This machine is what we call the leg curl. It allows for strengthening of the hamstring. The hamstrings are used to flex the knee. As you can see, as you flex the knee, the resistance happens on your hamstring. When you extend the knee, you want to use the helping foot to bring it up, to place less stress on the knee. That concludes two exercises that help stabilize the knee. What many people do not know is that before they begin all these exercises, they have to gain range of motion in their knee joint. How do you do that? A machine called continuous passive motion, or CPM machine, is used. They are mostly used during the first phase of rehab immediately after surgery. The goals of phase 1 rehabilitation are control post-operative pain, reduce inflammation, provide passive motion in a specific plane of movement, and protect the healing, repair, or tissue. CPM is carried out by a CPM device, which constantly moves the joint throughout a controlled range of motion. The exact range is dependent upon the joint, but in most cases, the range of motion is increased over time. Usually, you increase the range of motion by 10 to 15 degrees each day.